Thank you for inviting me to this YPC webinar. It is indeed a pleasure, and my special thanks to my very dear friend, Dr. Yusuf Khalu. The COVID-19 pandemic, as we all know, has caused widespread disruptions across the globe. It started off as a health crisis and soon evolved into a major economic and social fallout across the globe. The effects have been different both between and within countries, and even within countries, it is the marginalized groups who have been most hard hit. So these vulnerable groups in particular had to use a lot of coping methods or coping mechanisms in order to adjust and adapt to the impact of the crises. On one hand, while these coping mechanisms have long-term negative implications, on the other hand, the private and the public support schemes that were available for the vulnerable to cope were challenged with inefficiencies and shortages. So before moving on to the discussion on the types of coping mechanisms that have been most prevalent among the marginalized group, it is important to identify what are the specific factors that have led to the adoption of these coping mechanisms. In this case, the most critical factor is the economic vulnerability that has been enhanced by the pandemic. And these economic vulnerabilities have been mostly exacerbated for people below the poverty line, low-income households, and those marginally non-poor. So these effects have been channeled through the loss of employment, either temporarily or permanently, the loss of earnings or income through reduced work hours and wage cuts. So, and although there has been a high rejoining rate, at least what we have observed for Bangladesh, the rejoining has been mostly in the informal sector, that is low paid, low skilled, and less secure jobs. Moreover, another factor that has been responsible for the increased economic vulnerabilities has been the closure of businesses, particularly the cottage, micro, small, and medium-sized enterprises. If we dig into the statistics, for Morocco, an estimate by GIZ shows that the tourism sector, which has been hit by the pandemic, is estimated to incur an economic loss of around 138 billion Moroccan dirhams due to sector-specific weaknesses, especially in cases where informality has been a concern. So the global poverty has been on the rise by the pandemic. As shown by World Bank estimates, it is expected to erase progress equivalent to nearly 3 to 4 years of progress that was made towards ending poverty before the pandemic hit us. So narrowing down from the overall household level to youths in general, these same factors hold relevant, but the degree or severity of these economic vulnerabilities have been much more high on the youths compared to their adult counterparts. So again, going back to statistics, ILO, or the International Labour Organizations, estimated that in 2020, youth employment dropped by around 8.7%, which was almost 5 percentage points higher than the drop in employment for adults. And again, this effect has been much higher for youths from marginalized communities and the young females. So now coming to the question of what kinds of coping techniques have been adopted to adjust to these pandemic effects, both at the household level, which eventually had spillover to youths. These techniques can be categorized into 5 common types. The first is the drastic reduction in expenditure on food. From the Citizens Platform for SDGs, Bangladesh, We have conducted a survey on 1,600 marginalized households in February 2021, in which we have seen that despite of job losses, around 78% of the marginalized households reported to have reduced their food consumption. And this was mainly adjusted for by reduction in protein intake and reducing the number of meals and reducing the number of meal items. On top, the nutritional needs of the youths have been further compromised due to interruptions in the delivery of school meals due to prolonged school closures by the pandemic. And this was more severe in the early stages of the pandemic when lockdowns were enforced. So given the rise in food insecurity worldwide, it is a policy concern for the Middle East and North African region as well, which in 2020 had nearly 20% of acutely food insecure individuals, a rate much higher than the pre-COVID proportions. The second is the uptake of loan and withdrawal of savings. In an OECD survey conducted on 25,000 individuals across 25 OECD countries, around 20% of the youths reported that their households had to withdraw savings to pay for rents and utility bills. Around 11% had to take loans from friends and families, while a same proportion had to take on debt or credit. Now, if we compare these estimates with the figures that we have obtained from our survey, the rates are much higher, which could be indicative of the severe effects in developing countries. But then, of course, we have to consider the differences in sampling sizes and techniques for such comparative purposes. The third coping strategy is the distress selling of assets. Again, from our survey, we have seen a high proportion of 9% of marginalized households had to sell off their livestock in order to cope with the pandemic. And additionally, around 6% reported to have distress. Around 6% of the households had to distress sell their gold, labor, harvest, and land. The fourth is the assistance-based approach to coping. Given the high rates of informality in Morocco, which is around 63% of informal employment, mostly consisting of women and youths, and rates which are expected to rise further during the pandemic, the government's move to implement a cash transfer program for the informal workers using mobile phones is one such example of coping strategy for the informal workers. Last but not the least is the reduction in non-food expense at the household level. Most of the survey findings, at least what we have observed in Bangladesh, has focused on the reduction of expenses on recreational activities, housing, rent. But in my opinion, another significant area where household expenditure has been reduced was the education of the youths and children of those households, either temporarily or permanently. So their educational discontinuity has either forced the youths and the children to engage in labor or they have been married off by their families in order to reduce the economic burden. So these impacts are not just confined within the household level or the youth, but have long-term implications for the national development priorities of a country. A good example of which is the implication for the 2030 Agenda of the Sustainable Development Goals. From the Citizens Platform for SDGs, we have conducted a study to assess the implications for the SDGs using a novel index called the COVID-19 Impact Index for the SDGs. Very briefly, the studies indicate that the 4 SDG pillars, which we have considered in the study, including the economic, social, environment, and governance, have been affected at the high level by the pandemic, with effects expected to persist at least 3 years after the onset of the second wave of the COVID-19 pandemic in Bangladesh. Specifically, some of the highly affected SDG indicators are related to youth. For example, an increase in the proportion of youths not in education, employment, or training, which we term as NEET youths, relating to SDG 8.6.1, the incidences of early marriages, SDG 5.3.1, gender-based violence, that is SDG 5.2.1, and education. Nevertheless, the pandemic has opened up various avenues to build back better from the pandemic, and the 2030 agenda the 2030 agenda provides a good mechanism to achieve this. The applicability of the Sustainable Development Goals as a guiding framework to strategize an inclusive and sustainable recovery from the pandemic is relevant for governments across the globe, but this has to be facilitated by timely availability of quality data, which at the moment is one of the biggest constraints for researchers and policymakers. Thank you for your kind patience.